Welcome to Safecast Podcast, Europe Edition. We're here at Stanford, Florence for the next 3 months, and I'll be bringing you the most important voices in women's health and wellness right here in Europe. Para subtítulos en español, vaya a YouTube. Hi, welcome to another episode of Safe Chair. Today I'm here with Pier Indelli, who will be talking to us about orthopedics and women's health, and we're going to be learning from him about bone health, fractures, and a lot more. So thank you so much for joining us, Pierre. Would you be able to introduce yourself briefly?
Thank you, Diba. Yes, I'm Pier Indelli. I'm an Italian-American orthopedic surgeon. I originally trained at Stanford University, and then I was faculty there for many years. But I moved back to Italy in 2022. Now I am a hip and knee replacement surgeon in Tuscany as well on the Italian Dolomites. And it's great to be here and happy to help you with any of your questions.
Yeah, thank you for being with us. And I was lucky enough to be able to see the clinics that you work at, and one of them in Tuscany. So that has been a very interesting experience. And this got me interested in the topic of bone problems, specifically for women, because as women age, hormonal changes happen, and it really affects the type of like fractures or incidents that they have. So that's just like a brief background. And so, my first question for you is many people associate bone problems with older age, especially with women. What are the most important things women should do in their teens and 20s to build strong bones and prevent issues later in life? Maybe you could also give us a touch of the science background to this
Uh,
question.
uh, Absolutely. Yes, to build maximum bone density and prevent osteoporosis, and women in their teens and 20s must prioritize a good diet, right? Protein diet is great. Diet high in calcium, taking dairy, leafy greens, fortified foods, and then vitamin D, the hot topic, right? Everybody talks about vitamin D because vitamin D is essential for calcium absorption. And then exercise, right? 20, 15, 20 minutes of regular weight bearing and strength training exercises. And then we should avoid some foods and drinks, avoid smoking, caffeine, and limit alcohol intake. And it's very important to remember that peak bone mass is largely accumulated during those years, making early habits essential for long-term health.
Yeah, interesting you talk about having to build these good routines like early on. But it's also interesting that like with women throughout life, the hormone levels change. So how does hormonal health, especially during puberty, pregnancy, and menopause, affect bone density in women?
Yeah, hormonal shifts throughout a woman's lives primarily involving estrogen, right? Estrogens are another hot topic. Profoundly dictate bone density by regulating the balance between the bone formation and bone reabsorption. So, puberty builds peak bone mass usually. Pregnancy impacts significantly the mineral levels, and menopause causes rapid bone loss due to estrogen deficiency and increasing osteoporosis risk. Just to give you an idea, women can lose up to 20% of their bone mass within the 5 to 7 years after menopause. That's what happens. So an increase in osteoporosis is associated with higher risk of fractures, especially in spine and in hips. That's involved my work a lot. Estrogen deficiency can be mitigated, as you know, through hormone replacement therapy, something called HRT. And I highly recommend women to discuss with their primary care physician if hormone replacement therapy is appropriate for them. So this is a topic that should always be discussed with the PCP.
Yeah, and when women are looking to start having this discussion with their primary care provider, what early warning signs might suggest that their bone health is declining? And when should they consider getting a bone density test?
So yeah, bone density is something that we do. A baseline bone density test scan is generally recommended at age 65, but earlier testing around menopause is advised if risk factors like family history
Mm.
and bad habits like smoking or long-term steroid use or early menopause exist. What are the warning signs? Early warning signs of declining bone health in women include losing, for example, an inch or more in height, changes in posture, something that we call kyphosis, right? That patients develop kyphosis, persistent back pain from potential vertebral fractures, and breaking bones for minor incidents. Those are very high warning signs. Other indicators can be receding gums, weak grip. And brittle fingernails, for example. So look out for those things.
Yeah, that's very interesting, especially with what you're saying about the fingernails, because um, with Safe Chair, we go to hair salons and nail salons and educate the workers there to be able to talk to their clients about breast cancer and cervical cancer specifically, but just like what signs to look out for. And I remember one of the salon owners once asked us that if we could provide information about
Yeah,
what brittle hair and brittle nail meant. So sometimes it's nothing, but sometimes it could be an indicator for something bigger.
absolutely, absolutely. Watch
Yeah,
for those things and those basic things, right? Easy to discuss with patients. So,
yeah. And then based on your experience, because you see when people get the fractures, what are the most common like cases you see with women like throughout their life?
I see a lot of hip fractures for minor incidents, right? Really, minor faults can cause big fractures, and we have two kind of fractures. One is femoral neck fracture that's very common in menopause woman. And in that case, we have to replace the hip. So that's a major surgery, right?
Yeah.
And sometimes we have something called petrochanteric fracture. So it's a little bit lower than the femoral neck and the femoral head, and we have to fix those fractures with plates or nails, and that's also a long recovery because, for example, after a hip replacement, you can walk next day. But if you have a fracture a little bit lower than the hip itself, it needs a nail, and before going back, to full recovery can take 6 weeks, and before you start walking again can be also 2 or 3 weeks. It depends from the type of the fracture. So there are two very common fractures, and both require surgery because if you break your femur, less likely you can heal without surgery. That's the bad news, unfortunately.
Yeah. What is the operation that you perform most on women in your experience?
So the hip replacement is very common. Another is the wrist fracture because when you fall, you put your hands down. So you're and that probably 78% of the cases we can fix that with a cast. So you don't need for a wrist fracture an operation. But is the fracture is intraarticular, you need the plate. But that's again depends from the shape of the fracture. But differently from a hip, the hand sometimes we can treat it with a cast, and which is better for the patients, which does, they don't go, do not undergo surgery.
Yeah. Is there any special things you've seen also in female athletes, like moving a bit in a younger age?
ACL tear, right? ACL tears is a big issue, especially female athletes. So what is the problem there? That females have 5 to 7 times higher risk than males to tear the ACL. And there is a reason for that. It's a biomechanical reason that females had a wider pelvis. So when they jump and land, they tend to twist the knee with a valgus, we call valgus thrust. So it's the leg goes outward. and that put the ACL at risk of lesion. So this is very important for females and young athletes because they have to work a lot on their hamstrings, because it's always a good recommendation when you land from any jump, bend your knee. Don't land with a straight knee, because the risk of a tear of the ACL increases 5 to 7 times. So whenever you jump, whenever you land, bend your knees. It's a security belt for your ACL.
Yeah, and strengthening the hamstrings as well, probably.
Very important, because we are quad dominant.
Yeah.
Both men and females are quad dominant. We should use your hamstring, stretching the hamstrings, and use it. And use it when you land from a jump, or when you twist your knee. If you flex your knee, that protects your ACL from a tear, and the meniscus too.
Very important that we need to do those runner stretches with the
Sure.
calves. Yeah. And in your experience, what are the most common misconceptions women have about conditions like osteoporosis and osteopenia, and how can better education help prevent fracture later in life?
Yeah, that's a very good question. So, common misconceptions about osteoporosis and osteopenia include the belief that they are unavoidable, normal parts of aging. That's what we say, right? And that they only cause symptoms like pain when bones are already broken. And then only teen elderly women are at risk. But the reality is very different. These are manageable, silent conditions that can affect anyone, even younger women, often leading to severe fracture from very minimal activity. So education, education, education. And regarding education, better education helps prevent fractures later in life by increasing awareness, right, of bone health, and promoting proactive lifestyle changes, and teaching fall prevention techniques. We already discussed this a minute ago about an athlete, when you can what you can do to prevent your ACL to tear.
Yeah.
So education empowers individual to build stronger bones in their youth and maintain bone density in adulthood. So
Yeah.
this is my recommendation.
That's great because, like, I wanted to kind of recap exactly what were the recommendations here is like having proper nutrition, doing weightlifting type of exercises, and getting vitamin D, getting those micronutrients in, and then as well like learning the when you're jumping, bend the knees. And I'm not sure if we talked about this, but like how do you fall like and
Yeah.
catching a fall? Maybe you could also mention talk about that a bit.
So, it's preferable protect your lower part of your body, right? So when you fall, I know the first thing we do is a hand down, and that can cause a fracture of the wrist, fracture in the shoulder, a shoulder dislocation. But fracturing a hip, it's a major issue in a elderly patient, elderly woman. So I just want to touch base a little bit, just give you an idea on calcium and vitamin D. So calcium, is primary building block of bones, and low intake leads to lower bone density. So women age 19 to 50 should take 1 gram of calcium a day. If you're a little bit older, 1.2 grams. Those are the recommended dose. Regarding vitamin D, the best source of vitamin D are sunlight exposure, 15-20 minutes. That's good. Fortified foods, milk, cereals are good, right? Remember, grandma?
Yeah.
And fatty fish, so like salmon and tuna. And many adults require daily vitamin D supplement, especially in winter, or if they have limited sun exposure. So those are probably the take-home message. If you really need to know, what to do, those are the doses recommended of calcium and vitamin D.
That's perfect to know. That exactly, like just being proactive about it, and it doesn't take like crazy like treatments to be able to live healthy. Like just making sure you get those basic nutrients into your diet is really just all you need. Yeah. So thank you so much for sharing this information and giving te like also teaching me, but also teaching like whoever is listening about the connection between orthopedics and women's health. It's a bit of an area that we don't talk about as much, or it's usually talked about in the context of like hormonal health. But here, getting the perspective of someone who sees what happens if bone health is not properly maintained, that's also very valuable. Thank you so much for your time.
Thank you for having me. Have a great rest of your day. Ciao.
Ciao.